Hello everyone. I presume most of us are familiar with painkillers, particularly NSAIDs. By NSAIDs, I'm referring to medications such as ibuprofen, piroxicam, aspirin, diclofenac, among others. Now, these medications are the category that many individuals in Nigeria have easy access to buying. They simply walk into a pharmacy and acquire them. Although this accessibility is not a good thing, as you have many individuals who habitually consume these medications erroneously. For instance, instead of taking paracetamol for headache, they will say, I want something stronger. Consequently, what you get is people misuse these drugs on a daily basis. If you find yourself in this category, it is important that you cease from this practice immediately, as it increases your likelihood of developing chronic kidney disease. So what are NSAIDs? NSAIDs are non-steroidal anti-inflammatory drugs. They're often the go-to option for managing pain and inflammation, and they are used for a variety of conditions, from headaches, fever, arthritis pain, menstrual pains, muscle cramps, and a lot of others. Now, a lot of times in Nigeria, these medications are available as over-the-counter drugs. So people can easily walk into a pharmacy, they buy them and use them in their daily routine, without considering the long-term impact it can have on their kidney health. Now, the kidney functions by removing waste and excess fluid and also regulating electrolytes. However, NSAIDs used frequently and in high doses can impair the kidney's function in a very bad way. And if you continue to take NSAIDs for a long time, it can lead to CKD. What is CKD? Or chronic kidney disease is a progressive decline in the kidney's ability to perform its function of taking waste out of the system, and it leads to accumulation of waste in the body. The primary causes of CKD are diabetes and high blood pressure, but NSAIDs are increasingly being recognized as a major risk factor, especially for individuals with vulnerable kidney conditions. How do NSAIDs work? They work by blocking the production of prostaglandins. Now, prostaglandin causes inflammation and pain, but the prostaglandins are not altogether a bad thing, because they have a secondary effect which is beneficial. They stimulate the vessels in the kidney to allowing blood flow. So what they do is they cause an opening in the vessel and allow blood to flow, so that the kidney can carry out this function of taking waste out of the system. So if you take NSAIDs for too long a time or too much, it will lead to limiting that blood flow and reducing filtration, which can progress in the long term into kidney damage like CKD. So for individuals with pre-existing conditions like high blood pressure and diabetes and even a mild kidney impairment, they fall into the category of greater risk, because their kidneys are already working harder to maintain this function. Older individuals are also at risk, because what you have is that with age, the kidney reduces in its ability to carry out its function. That is why using NSAIDs also with old people is not too much with old people is not a good thing, as it can lead to damaging effect in the kidney and consequently into CKD for the long term. So for those using NSAID regularly, it's important that you look out for certain signs. Number one is reduced urine output, as less urine production can indicate that the kidneys are not filtering properly. Other symptoms that you can look out for is swelling in the legs, in the ankles, and in the feet as a result of fluid retention. Another symptom is fatigue and shortness of breath resulting from waste accumulation. There is also nausea and loss of appetite. It is important that you consult your healthcare provider if any of these symptoms are present, especially if NSAIDs are part of your regular pain management routine. We're going to look at the strategies that are important to reduce NSAID-related kidney risk. Number one, limit the use of NSAIDs and consider alternatives. And many times that the topical preparation might just be enough or may just suffice. So use alternatives. You don't just rush out to use painkillers all the time. Number two, it's important that you use the lowest effective dose for the shortest time. Now, if NSAIDs are necessary, use the lowest effective dose for the shortest time to prevent any damaging impact on your kidneys. Avoid combining NSAIDs, as this can increase the risk of kidney damage. Number 3, stay hydrated. Drinking water is good for everybody. Drink plenty of water, and because it can help your kidney function effectively, and it reduces the risk of adverse effects when NSAIDs are used. Number 4, it's important that you monitor your kidney function regularly. For those with hypertension and diabetes or any other form of kidney disease, it is important that you regularly monitor your kidneys function by doing the following tests. 1, you check your serum creatinine. Number 2, you can also check your glomerular filtration rate, GFR, as this can help detect an impairment in the kidneys, and can also make the doctor introduce necessary interventions. Number 5, which is very, very important, is that you got to consult your healthcare provider. You got to always speak to your healthcare provider with regards to management of pain. You don't just by yourself jump into taking pain drugs anyhow, because it can have, in the long term, a damaging effect on your kidneys. Number 6, you've got to ensure that you have a long-term view in managing your kidney. You got to prevent and protect your kidneys. I mean, you don't buy it in the market easily. Yeah, people buy it, they do transplant, but your long-term goal will be to do things that will not impair your kidney. Use NSAIDs responsibly. Understand what your kidney needs to be healthy. Now, because the kidney disease is a silent disease progressing unnoticeable for a long time until significant damage has been done. So by using NSAIDs judiciously and staying vigilant about your kidney and NSAID-induced CKD, you can preserve your kidney in the long haul. Awareness is key. Protect your kidneys, manage pain through alternative methods, stay hydrated, seek medical guidance that can help you protect against adverse effects on your kidneys. Remember, when you protect your kidney, it will have a lasting benefit for your body and your overall quality of life. Thanks for tuning in. If you found this episode helpful, don't forget to subscribe, share it with others, and leave a review. If there's any question or topics that you feel we should cover in the future episodes, feel free to reach out to us. Until next time, take care of your kidneys and take care of yourself. God bless you. Thank you.